So super quick, I'm hopping on here because I see so many people who suffer long-term with post-concussive symptoms, and part of the issue is their cervical instability. And I want to give a set of isometrics building a foundation that people can do to just wake up the muscles, give the hippocampus a new working memory for how it's been holding that head on the neck and the neck on the rib cage, so that we have good blood flow to and from the brain. We have good lymphatic flow out of the brain to get rid of debris. We also have good nerve conduction and communication pathways from the periphery to the brain and back. So the first one we're going to do is to build a foundation for what we're going to do in the neck. And that is to stabilize the thoracic spine, the T-spine, the spine that's around your rib cage. So I like to have people cross their arms just because they'll use body parts if they have their arms to the side. And the first thing you want to do is give thoracic extension, which means poke your chest out. And then you're going to rotate to one side or the other with keeping your butt cheeks in place. You want to use a chair with a nice back to it if you can, or maybe get against the wall. And you're going to gently press into the back of that chair, holding for 10 seconds and giving yourself some nice breathing through it. When I tell people to hold their muscles, they hold their breath. And after you've done 10 seconds, you come out of that position, poke your chest out again, and just do the other side. And then you're just going to rotate back and forth until you've done that 10 seconds, 5 reps each. Now that you've got your T-spine, the spine that's on your rib cage, you've built that first foundation. You're going to do the same thing for your neck, your C-spine, your cervical spine, or the muscles that surround your neck and help you hold your head up on your neck. Now you know the cervical extensors attached down in between the shoulder blades. I'm going to push this chair back so I can be close to the wall. And what you're going to do is slightly tuck your chin. You're going to slightly rotate to the right. And you're going to have a wall back here where you gently press. You don't have to do as hard as you can, but you're going to press and hold for 10 seconds, breathing through that as well. And then you'll switch sides. Chin slightly tucked, rotate slightly left, press, and you will be able to feel which side might be weaker, and maybe both of them are weak. And if you can't do 5 repetitions of each side yet, just work your way up to it. It's okay if you can only do 1 or 2. But once you've turned just slightly with the chin tucked, you're going to turn a little more, maybe halfway between center and looking over your shoulder. And you're going to do the same thing, pressing gently back, hold for 10 seconds, breathe through it nice and calmly, rotate to the other side, halfway between center and to the left, press back and hold with your neck. Again, you'll probably feel that one side or the other, or maybe both, feel kind of weak or shaky, and that's okay. You're just building that ability to apply force and resist it, and you're giving that hippocampus a brand new memory of how it's been holding you together after this insult to your brain, right? So after you have done that, we're going to move into these tiny isometrics that are actually for the upper cervical muscles. Some people call them the suboccipital muscles, but there's a couple of more involved in this, and we're going to do those as well. Stay tuned. Okay, we're back. I brought the video a little bit closer so you can see what I'm going to do, because we're going to use our thumbs and we're going to place them on different parts of our jaw so that we can provide just a little bit of resistance with a little bit of flexion, extension, and rotation into these positions. My first one I want you to do is to go right to the corner of your jaw here and put your thumb there, sit up nice and tall, and you're going to gently press into rotation against that thumb. Again, breathing, so you don't hold your breath. We want good oxygenation, and you'll hold for 10 seconds. Then you take your opposite thumb on the corner of that jaw, rotate the other way, push into that thumb. Same thing, you're breathing, you're just getting teeny tiny supportive muscles that help you. Once you get these down, and you're going to again repeat 5 times on each side, Then you're going to rotate slightly right and put the thumb right to the right of your lips under your chin, and you're going to tuck like that, like you're trying to hold a little orange or something, or a little tangerine at your chin, but you're just going to press down and hold. Then you rotate slightly left, press down and hold. Again, we're going to repeat these 10-second holds each time and do 5 repetitions on each side. You got it so far? Great. This one you won't be able to see. I'm still going to use my thumb, and I'm going to feel for the base of my skull and then bring my thumb just above that onto what's called the occipital bone, or the occiput. And you're going to rotate slightly right, and then you're just going to lift your chin into the resistance of that thumb and breathe through it. And of course, we're doing the other side. You take your thumb, find the base of the skull, and then roll it up onto the back of that head on the occipital bone, and lift and hold, always breathing through these exercises. Last but not least, we're coming back to the corner of that jaw. You're going to put your thumb right at the corner. So as your jaw comes back and it's going to go up at this angle, you're going to go right to the corner. You're facing front, and all you're going to do is do a little side tilt into that thumb, breathing through it, 10-second hold. Go to the other side, find that corner, 10-second hold. After you complete these, you should feel like your head has lost a few pounds. And it doesn't mean that your brain got lighter. It actually means that your muscles got better at holding it up. And this cervical stability is so important for getting proper blood flow. The other thing that sits right in here is the vagus nerve, straight down from the brainstem. It has information coming to it from all the organs in your body, and it sends information down to all the organs in your body. So many issues can be supported toward healing if you give this baseline of cervical stability. I really hope you enjoyed this, and I hope it makes sense to you. You're welcome to contact me if you need further information. This is just something that I do for people when they come in with these post-concussive symptoms that sometimes have been going on for years. And it's a great way to just establish communication loops, give support to the head on the neck, and allow for that free flow of lymphatics and blood and nervous system, everything that comes through here to support healing the brain. Thank you. So I know I said last but not least to the ones at the corner of your chin, but I have a transition exercise that leads me into the advanced version of these exercises. Advanced sounds funny. They're the same exercises, but we're going to add eye movements to them. So what I'm going to want you to do is take your thumb right to the corner of your eyebrow, up at a 45-degree angle from straight up. And I add an eye movement to this one because when I ask people to do these isometrics, they struggle to figure out which direction they're supposed to go in, which tells you they probably have a lack of proprioception in these upper cervical muscles anyway. But what I ask people to do is put their thumb, or I do it for them, right at that corner at a 45-degree angle, and I have them tuck their chin slightly and rotate away from the thumb I'm using. And then I say, look at your thumb. And while they're looking, I say, now do an isometric in the direction of the thumb. So that is moving out of chin tuck and out of rotation toward the other side. Again, you're going to look and hold 10 seconds. Then you go to the other side, right at the corner of the eyebrow at a 45-degree angle. You rotate the opposite way, so to the left with your right thumb on your right eyebrow. Tuck your chin, look at the eye, and move into it. You don't want to be moving up and out, but you're moving in that direction. And that is a really good one for a couple of those suboccipital muscles that actually extend and slightly rotate at the occiput. It's going to really, really help you. So now what do I mean by doing the advanced version? Well, once you master the version I showed you without eye movements, naturally you're going to add the eye movements, and they go in all directions except for convergence. You can do convergence on your own without the isometrics. But when you have your fingers here at the edge of the chin and you rotate, when you have the right thumb, you look right, left thumb look left. Under the chin here, you're going to look down. You get 2 of those because you're going to look down, and you'll find that some people have a harder time on one side or the other sometimes, and it's just data that you're collecting to know what you need to do next. Then when you come, when you come to the back of the occiput and you roll your thumb up and you rotate and you look back, you're going to look up. Same thing over here, looking up. Then when you come to the edge of the chin, you're going to look down and right with the right thumb, down and left with the left thumb. And then, of course, I showed you this one, right? Where you're going up and left with the left thumb, looking up and right with the right thumb. So you've got all of those eye muscles coordinating with these little isometrics for those upper cervical suboccipital muscles that we all need for cervical stability, which is going to help with the blood flow, help with the nervous system flow, help with the vagus nerve function. So much is going on in this area right here that we can improve by creating that cervical stability. I hope you enjoyed this. You can certainly reach out to me if you have any questions. Hopefully these will help your clients and patients function and feel better, especially after some kind of head insult or injury. Thanks so much.